Okay, good afternoon or good evening, everybody. Welcome back to another insightful session of our Laboratory Quality Management System webinar series. Each week, we try to dive deeper into essential aspects of laboratory quality management, guided by experienced facilitators who are leaders in the field of pathology. Today's session is on ensuring compliance through laboratory assessments and audits. This session will provide valuable insight into the practical strategies to improve your laboratory processes. I encourage you all to engage actively, share your experiences, and take advantage of the expertise available on this platform. Let us continue working together towards strengthening our laboratory systems for better healthcare outcomes. I'll be introducing Dr. Meka Ijeoma, who is an associate professor at the College of Medicine, University of Nigeria. And she's also a fellow of the National Postgraduate College of Nigeria and an international fellow of the College of American Pathologists. Please welcome Dr. Meka Ijeoma. Thank you very much.
Okay. Thank you, Bruno, for that introduction. And I welcome everyone to today's session where we'll be discussing ensuring compliance through laboratory assessments and audits. So we'll quickly run through our objectives. We are going to be talking about internal audits. Then we'll look at elements of ISO 15189. So, assessments. Let's talk about assessments. This is a means for determining the effectiveness of a lab's quality management system. And this is largely done through the use of internal and external audits. Now, by way of definition, we can define an assessment as a systematic examination of some parts of the QMS, or sometimes all of the parts of the QMS, to demonstrate to all concerned that the lab in question meets regulatory, accreditation, and customer requirements. And when we discuss assessments, we definitely talk about accepted standards, because that is what you do your assessment and compare it against. So these accepted standards can be international, can be national, or can be local. Or it can also be standards from accrediting organizations. And these standards are what form the basis for lab assessments. And now when we're talking about assessments, we begin to ask questions. We begin to ask questions, certain questions which are vital in the process of lab assessments. First of all, you ask, what procedures and processes do you follow in your lab? So when you're working in your lab, what do you do? What procedures and processes do you follow? You ask yourself that question. Then you go ahead and ask, now, those procedures and processes you follow, are they written down anywhere? Do they comply with do they comply with written policies and procedures? Do they comply with written policies and procedures? In fact, do you even have written policies and procedures in your lab? So can an assessor come, or an auditor come and ask, can I see your procedures? Can I see your policies written? And you are able to show those written procedures and policies. Are they available in your labs? And the third one is whether those written policies so are key questions to be answered, asked and answered when we are talking about laboratory assessments. So now, let's talk about audits. The ISO definition for audit is a systematic, independent, and documented process for obtaining evidence and evaluating it objectively to determine the extent to which required criteria are fulfilled. And an audit can also be defined as a systematic process to evaluate a lab's performance, procedures, and compliance with standards, policies, and regulations. So now some terms stand out in these definitions. One is systematic. So an audit certainly has to be systematic. It follows a certain procedure, some criteria. It's not done randomly. It's not something you just wake up tomorrow one day and say, okay, I want to do an audit. No, it has to be done in a systematic process. And then it has to be compared with some standards, some written down standards, for you to be able to say that your lab performance is in compliance with these set out standards. So these are key. It has to be systematic, it has to be documented. That is another important aspect of audits. Documentation is very critical. Now, why do we bother to perform audits or assessments? Why do we bother? First is for planning and implementing the quality system. For planning and implementing the quality system. And then to monitor the effectiveness of the quality system. Very importantly, you need to monitor how effective is your quality system, and this is done via audits. And then when you identify any deficiencies, audits will help you to track record of whether it's been corrected, whether it has been corrected, or is it in the process of being corrected. For working towards continuous improvement, very important, towards continuous improvement. And then it ensures adherence to good laboratory practices. This cannot be overemphasized. Now, in the beginning, we mentioned internal and external audits. What is internal audits? This is done by lab personnel not directly working in a particular section of the lab. So for internal, it is done by staff, by personnel working in that lab. However, they will not be working in the particular section of the lab where you want to audit. Okay? So that somebody doesn't have to audit himself or herself. It is internal, they are working in the lab, but when you want to audit a particular section, you don't use personnel who are working in that particular section of the lab to audit that particular section. Then external, this is done by groups or agencies who come from outside of the laboratories. So these individuals may be from, let's say, the ministries, government ministries, can be from any funding agencies, it can be from even your hospital management. So they can decide to come and audit a particular section of your lab for a particular purpose. So these people come into your lab and they audit a section or otherwise of the lab. So it can be for accreditation purposes, it can be for certification purposes. Now, audits need to be conducted by well-experienced audit team who are proficient in the application of lab requirements. Or at the very least, if you don't have that crop of experienced audit team, the team should at least be led by an experienced team lead. So, because you can build capacity in the process. So the team lead will have to be somebody who is experienced, and in the process of training the others, auditing, it will be the team lead will be training others and be building capacity. So that is also one importance of internal audits. So let's just broadly look at the differences between internal and external audits. We've done the definition. This is conducted by own staff, while external is conducted by an independent external body. What is the objective? Quality improvement for internal, early detection of non-conformities, and then to prepare the lab for an external audit For external audit, it ensures regulatory compliance. It prepares the laboratory towards accreditation and certification. It's conducted, we've talked about this, internal auditors. For external, others from outside of the laboratories, you call these people third-party auditors. So they can be from regulatory agencies, accreditation bodies, or other certifying organizations. How often do you carry out audits? For internal audits, it is usually based on organizational policies, on your organizational needs. So it's expected that it to be irregular affair. Okay, so in your organizational audit, you can specify there that you're going to be carrying out audits monthly, quarterly, or annually. But for external, it's periodic. It's not a regular thing. It is when the regulatory agencies or the management or whoever is authorizing that audit, when they want it, they send people to come and carry out an external audit. Now, what's the scope? Internal audits focus on internal processes, on your efficiency and continuous improvement, whereas external evaluates compliance with external standards and regulations. And at the end of the audits, the auditors don't just close their books and keep it on the shelf or keep it in the drawer. No. They have to report their findings to the lab management. That is for internal audit now. You must report your findings to the lab management, and this is essential for corrective actions to take place. Because if you just close your books and keep it somewhere, nobody knows your findings from your audits. So the reports must be made to the relevant laboratory management. But external audits findings are reported to whoever authorized that external audit. Okay. Now, what's the impact? Internal helps to identify and resolve issues before external audits, improving overall compliance readiness, whereas external determines the laboratory's compliance status. Okay, so let's move on. What is audited? So in the process of the auditing, what is audited? Essentially, every aspect of the laboratory's QMS is audited. The quality management, quality assurance, quality control, everything is audited. So they come down to your facility, the environment, safety and security of your facility. Where is it located? Is it located in a flood-prone area? Is the environment safe for the people who are working there? Very important. So it is part of what is audited. How is your organization and management? Will agree with me that in every well-organized laboratory, you must find an organogram. So that shows the line of command, the chain of command in that organization, because order is very important. In a place where there is chaos, you can hardly achieve anything. So organization, management, chain of command is very important in every laboratory so that everybody knows who is responsible for this. Who do you report to? Who are you answerable to? It must be specified, documented, and everybody should be aware of that. The personnel, orientations, training. There must be evidence that the personnel are adequately qualified. How have they been oriented towards working in that particular lab? Do you carry out trainings and retrainings of your personnel? Very important. It is part of what is audited. Document control, SOPs. Definitely, you cannot escape this. It must be there for auditing. The documents in your laboratories must be such that they are controlled documents, in the sense that it's not what you had 20 years ago that you're going to be presenting to auditors in the year 2025. So you need to show evidence of your documents being updated. What versions have they gone through? That is document control. They there is need for evidence that your documents have been updated, have gone through some versions. So that is document control. And also you also have to show evidence of your SOPs that you follow while working. Method validation is also audited. Sample transport receipt processing, very important for pre-analytical errors. The auditors always need to see how you handle these pre-analytical aspects of your QMS. And of course, specimen collection handling are equally part of that. They go down as far as looking at your glassware, the quality of water. What quality of water do you use in the laboratory? Do you have a practice of a standard quality of water being used, or is it that anybody can just take water, maybe open the taps, you're running on a bench, you're running samples on a bench, you just open the tap, collect water and use it? What do you use in your laboratory? How do you clean your glassware? How do you wash? The people who handle your washing, your glassware washing, how do they do that? Are they trained? Do they know what it means for glassware to be clean? All these are important in the laboratory and they are part of what is audited. Of course, reagents, that one is standard. How do you source your reagents? How do you certify? How do you know that your reagents are okay, are potent? Equipment calibration and maintenance, very key. Definitely at every visit, auditors will require your equipment book of life. You need to show evidence of how regular you carry out equipment maintenance, equipment calibration, and all these need to be documented, because if you just tell auditors, okay, we do this every 3 months, every 4 months, the question is, what is the evidence? How is it documented? Where is it documented? I believe we know the equipment book of life. That is key to every audit and must be provided. Reporting of results. This is also very key. They want to know, what are you using? How do you report your results? Do you use the LIMS? Do you do manual reporting? How is this done? Are results reported before they leave the laboratory? It is also part of what is audited. Sample management, of course, this is part of the pre-analytical issues. Your electronic systems like the LIMS that I just mentioned. Your data management, how do you handle your data? How do you secure your data? Do you have backup systems? If you're using LIMS, is there any backup? If you're using a manual, is there any backup? So if something happens, how do you back up your systems? How do you protect your data? How do you secure your data? Very important. So essentially, all the steps in the whole lab path of workflow is audited. All the steps are audited. Okay. And then the findings are compared with your internal policies. This is why it's very important that every lab will have your policies written down. So the essence is, all these things you're looking at, all these things you're telling us, do they tally with what you said you are doing? Do they tally with your policies? Okay. And also to a standard or an external benchmark. So we've talked about internal and external audit. So how do you prepare for an external audit? Please, can you mute? Can you please mute? How do you prepare for an external audit? We've talked about different standards which can be used for these assessment processes, and these standards range from international standards to a locally developed checklist, okay? Because yes, you want international best practices in our laboratories, but sometimes you need to bring it down and make it adaptable to your local environment. So sometimes you need to step down and have a locally developed checklist, which will still be in compliance with your international standards. So to be ready for an external audit, and it's important that you're ready for your external audit, because a lot of times because these external auditors are coming from outside your laboratories, is most times cost intensive. So you don't want a wasted effort. And then you also have to bear in mind that an external audit is going to be reported to an external personality, to an external authority, an external agency, okay? So you need to plan carefully and thoroughly for an external audit. And audits take time. So the external auditors don't want to come, and then you're wasting time on one. They ask you, can we have this? And you're taking 1 hour to get that, just one document. And at the end of the day, they don't accomplish what they came for. No, they will always want you to organize everything ahead of time, including the documents and records they require to save them valuable time. So you need to make all staff aware of the audits and arrange schedules so that all staff needed for the audit will be available. However, there can be impromptu external audits. So sometimes some external audits might occur without prior notification. And this is why it is very important for laboratories to always follow your policies, to always follow your best practices, best international practices, so that it's not, if maybe you have an impromptu visit, then you begin to run helter-skelter and you begin to get confused. It tell you what you know. In fact, like one of my senior colleagues will say that he thinks that, in fact, that for any auditor to know what actually happens in a laboratory, that impromptu visits are the best, so that you come and see what is happening without any extra arrangements, any extra preparations. Because sometimes we inform a lab that people are coming in to audit, and then they begin to make preparations, begin to put everything in place. However, those things may not really reflect the standard practice which happens in that laboratory. So that if you really want to know what exactly happens, that impromptu audits are the best. However, it may not be very feasible because, like I said, it's cost intensive. Okay, so before these people come, some preparations need to be made. But however, we just have to know how to balance that. But the bottom line is that laboratories need to do what they say they do. You need to do what you have. You need to have a policy, lab policy, and follow the lab policy. Do not when an external visitor is coming, you begin to put so many things in place, and then when they turn their back, you go back to unacceptable practices. So for impromptu audits, the lab may not be able to make special preparations, so the lab should always be sure its system is operating properly. So now let's talk more about internal audits, because these internal audits are essential aspects of the QMS, and it allows the lab to look at its own processes. So it can be performed as frequently as needed, in contrast to external, and at very little or no cost, because it's using the lab staff, internal personnel. An internal audit should be a part of every laboratory QMS, and they are a requirement of ISO standards. So if your laboratory is seeking accreditation under ISO 15189, internal audits are essential and a requirement of that standard. So according to your lab policy, you need to designate time intervals when to conduct internal audits. You can say you conduct it every 3 months, every 4 months, every 6 months, but minimum, it must be done every year, at least once a year. That is according to your lab policy. Again, you need to conduct audits when you begin to see problems, when problems begin to be identified. It can be the clinicians calling the lab and saying, making complaints about this particular result, this particular test. It might be time to conduct an internal audit. It might also be after you receive a poor performance on a PT survey. When you receive a poor performance on a PT proficiency testing survey, you might need to conduct an internal audit. After an increased number of unexpected abnormal results for a particular test, you might need to conduct an internal audit. Then, when your turnaround time increases unexpectedly beyond what it's meant to be, it might also be time to conduct an internal audit to probe into what is causing these undesirable events, undesirable fallouts. Okay? So, what are the benefits? Continuing effectiveness of your QMS, you need to verify that and to gauge how effectively your internal control processes are performing. It is a very big benefit of internal audits. You need to verify how your internal control processes are performing. It increases staff awareness of quality system requirements, because you don't assume that somebody should know something. So if your lab doesn't have a culture of internal audits, it is possible that your staff may not know what is expected of them. So, but if you conduct internal audits ahead, then they will be able to know when you request for this, they will be able to know that this is requested of them, this is expected of them. So it increases their awareness of what is expected in their line of duty. Of course, we've said it prepares for external audits and identifies critical non-conformities. And it identifies areas where education or training needs are required. So when you identify these critical non-conformities, it exposes you that you're not supposed to assume. Then it tells you this particular staff or this group of staff, they need to be educated or they need to be trained on this aspect of the lab QMS. So it's very important. It ensures that your lab is up to date with changing standards and regulations, because it cannot be as it was in 1924. So it cannot be like that. You need to change with changing standards and changing regulations. And when a lab remains audit ready, it builds credibility to external auditors if they carry out impromptu audits. Very important. So I mentioned before that if your lab is seeking accreditation under ISO 15189, there are requirements, because this standard sets out clear requirements for internal audits. They don't joke with internal audits. They consider it very critical for a laboratory. So section 8832 of this ISO 15189 establishes that the laboratory should plan and maintain an internal audit program, and that this program should give priority to laboratory activities which predispose risk to patients. Your internal audit program should give priority to your activities that predispose risk to patients. And your audit program should include a schedule which takes into consideration the identified risks, the outcomes of both external and internal audits previously done, occurrence of non-conformities, incidents, complaints, and changes affecting the lab activities. So it should give priority to these areas. So when you're putting together your internal audit program, when you're looking at areas to audit, you should give preference to these areas. Outcomes of both previous audits that were done, if they found out that these areas were lacking, you need to give preference, attention to those areas in your next audit visits. Occurrence of non-conformities, incidents, complaints. When clinicians, clients begin to complain about a particular test, you give preference to those areas in your audit program. You need to specify your audit objectives, the criteria and scope for each audit. Like I mentioned before, audits can be laborious, can be time consuming. So you need to specify the scope of each audit you want to carry out. it may not be feasible to say, I want to audit the whole lab, even though this may vary between laboratories. But if you are a kind of a standard laboratory which carries out so many tests, it may not be feasible to say, I want to audit the whole lab. So you might want to specify the scope. You can say, we'll take for today, we'll audit the reception, the specimen processing area. Another day, you may audit 3 or 4 benches. You need to spell out the scope for each of your audits, okay? So that at the end of the day, you'll be able to accomplish what you set out to accomplish. Now, the audit program should also select auditors who are trained, qualified, and authorized, and whenever resources permit, who are independent of the activity to be audited. We've mentioned this before, that a personnel, you don't audit your own area of work. So another person needs to audit what you're doing. Then your audit program should ensure objectivity and impartiality of the audit process. So when you're serving as an auditor and you come to a bench, for instance, you don't say, because this person manning this bench is my friend, let me just check all the boxes for him or her. No, you must maintain objectivity. You must maintain impartiality of the audit. Otherwise, you just make a mess of the audit process. Okay, so you don't have sentiments when you're conducting audits. And at the end of the audit process, the findings must be reported to the relevant personnel for implementation of corrective actions without undue delay. Then documentation, you must record the findings of that audit and retain the records as evidence that you actually carried out an audit program. So ISO standards put much emphasis on internal audits. So, and if your lab is seeking accreditation, internal audits are required, very important for ISO standards. Now I put this here. This was, I put it out from the 2007 documents for ISO 15189. You know, we are dealing with 2022 document now, but in 2022 documents, they changed this. So this is not stated like this in 2022 document, but I felt this would be important, especially for a laboratory which doesn't have a culture for internal audits, that maybe you want to start conducting internal audits. So this 2007 version gives you the frequency. So it said it should normally be subject to internal audit once every 12 months. So this is the minimum for you, at least in a particular year, you must conduct internal audits once every 12 months. So it went further to state that the policy, you should establish a policy that specified intervals, some section of the lab will have an internal audit. And you can consider 3 to 6 months intervals between audits. But if your audit reveals specific problems, it may be necessary to include more frequent audits. Okay, so if you look at the right-hand side, you have, that is the audit program cycle. Just a summary of how audits go. You establish the areas of priority. You have mentioned it, especially areas where you're receiving complaints, previous reports, poses some risk to patients. Establish those areas of priority. Then identify auditing requirements. Then you go ahead to schedule your auditing frequency. Then you conduct the audits. After that, you manage your results. After managing results, we said, importantly, you must be reported to the relevant laboratory personnel. So you report your audit results. Then together with the personnel, you analyze the audit reports and the new risk and establish corrective and preventive actions. And then the cycle continues. So the post audit action plan, this is still what we've talked about. You review the recommendations of the assessors, identify non-conformities, gaps, learning where benchmarks or standards were not fully met. Then plan to correct the non-conformities and record all results and actions taken so that the lab has a permanent record of that event. Often a written report is useful for preserving all information because that serves as your evidence that this audit was actually conducted, because it said that once something is not documented, that thing is not done. So documentation is very important. What are the common challenges and solutions you find when you're implementing audits? The first is resistance from staff due to fear of blame. Okay, they may be afraid that maybe their boss is going to punish them for not conforming to this or this. But solution is that you promote a culture of learning rather than punishment. So audit is not carried out so that you punish anybody. Like we said before, it establishes education and training needs. So when you see gaps, when you see conformities, it is not for punishment to occur. No, rather it is for the person to learn the right thing and then start doing the right thing. Another challenge is lack of trained internal auditors. So this can also be pushed up when you begin to conduct audits. You may find out that you don't have trained internal auditors. So you need to provide training in audit methodologies. I've mentioned it before, you may need to build capacity in this area of auditing. You might have inconsistent audit frequency or scope. So this is why you need to have it established in your lab policy. You need to have it established in your lab policy that we carry out audits at so frequency so that it's not an inconsistent thing. So when staff know that audits occurs at this period, everybody knows what to do. Poor documentation and follow-up on audit findings. The solution may be to implement digital audit tools for tracking non-conformities and corrective and preventive actions. We will talk about digital audit tools at the last section of this presentation. But the thing is that it's very important for documentation to occur, because once anything is not documented, it's taken that thing, it's not done. So let's talk about external quality assessment. This is the second aspect of this presentation. We've talked about internal and external audits. The next is lab assessments in the form of external quality assessment. So according to WHO, they defined EQA as a system for objectively checking the lab's performance using an external agency or facility. So this is an objective checking now of any laboratory's performance using an external agency or facility. And there are basically three types of EQA. One is proficiency testing, then the rechecking or retesting, and on-site evaluation. Proficiency testing is by far the commonest and the one we are mostly used to, which typically involves sending out unknown samples to participating laboratories, and then the laboratories analyze those samples and send back to the PT provider, who will now analyze their results against a reference value. Then the second one is rechecking or retesting. Under this type, slides that have been read by someone are now rechecked by a reference laboratory, or samples that have been analyzed are retested. This allows for inter-laboratory comparison. And then when proficiency testing or rechecking or retesting, when these are not feasible, you now come down to on-site evaluation, which requires the assessors coming down to your laboratory to physically witness what you're doing. So it's done when it's difficult to conduct the traditional proficiency testing or to using. So they have to come down physically and now look at you physically to see what happens in your laboratory. Now, considering EQA, of course, the standard at 15189 also has its requirements considering as when it concerns EQA. And what are these requirements? Under section 7373, it states that the lab shall monitor its performance by comparison with results of other laboratory, which includes participating in EQA programs. So it is specific and clear on this, that your lab needs to participate in EQA programs. However, when the EQA program is either not available or not considered suitable, it gave some acceptable alternatives, like participating in sample exchanges with other laboratories, interlab comparisons using identical IQC materials, analysis of a different lot number of manufacturers' calibrator or manufacturers' control material. Then for microbiology, using split or bind testing of the same sample by at least 2 persons or at least 2 analyzers or by at least 2 methods. Then analyzing reference materials considered to be commutable with patient samples, analyzing patient results from clinical correlation studies, and also analyzing materials from cell and tissue repositories. So these are accepted alternatives as stated by ISO 15189. Now, the standards still went further to make these requirements, especially when you're participating in a PT program, a proficiency testing program. Now that EQA data shall be reviewed at regular intervals with specified acceptability criteria in a time frame which allows for a meaningful indication of current performance. What this means is that when you're participating in this PT program, you have finished analyzing your results, you've sent to the providers, and they have sent you your results. You need to review those results. It's not just enough to participate and get back your results. Those results need to be reviewed and at a good record time to allow for a meaningful indication of current performance. So you don't keep it maybe after a period of time when maybe even the person who conducted that test had even left the bench and moved to another bench. You now begin to review the EQA data. No. The requirement states that it shall be reviewed at regular intervals, which allows for meaningful indication of current performance. Then, when your results fall outside the specified acceptable criteria, appropriate action needs to be taken, including assessment of whether the nonconformity is clinically significant as it relates to patient samples. And when it's determined that it's clinically significant, a review of patient results that could have been affected and the need for amendment shall be considered and users advised as appropriate. So these are still under the requirements of the ISO 15189 standards concerning EQA. The benefits, of course, cannot be overemphasized. It allows comparison among different test sites, early warning for systematic problems associated with kits or operations, provides objective evidence of testing quality, indicates areas which need improvement, identifies training needs, and of course, they are required by accreditation bodies and ensures comparable results during surveillance activities. Now, that last point is very important. Comparable results during surveillance activities. So you can imagine diseases of public health importance, let's say poliovirus, for instance. So they need to be sure that if you're saying you identify this virus, then you must be sure of what you're saying. because it can be embarrassing for the government to announce that maybe in so place that this virus was reported, and then tomorrow you turn around and say, no, sorry, it seems that maybe there was a mistake. No, that is not acceptable. So that is why EQA is key and for any laboratory, which if you're engaging in surveillance activities, you need to be sure that whatever you report, whatever you positive test that you're going to report is actually the correct thing. Okay? So proficiency testing is used to evaluate a laboratory's performance, and importantly, it validates the entire testing process. That is one beautiful thing about proficiency testing. It validates the entire testing process, including the testing personnel competency. Now, how does it work? The program provider, the PT provider, will send samples to your lab on a regular basis. Usually, it's 3 to 6 times each year. For some providers, they send 3 times a year. Some providers will send 6 times a year. Now, after the testing, your lab will report its results to the PT program provider. And that program provider will now compare your lab's test results against CLIA grading criteria. CLIA is Clinical Laboratory Improvement Amendment Grading Criteria. They will now, after that, they will now send the laboratory scores reflecting how accurately it performed the testing. So now let's talk a bit more about the CLIA regulatory. So CLIA, the Clinical Laboratory Improvement Assessment, these are US standards that apply to any facility which performs lab testing on human specimens. So as long as you're testing conducting laboratory tests on human specimens in the US, you must conform to the CLIA standards. Okay. Now, this CLIA criteria was first passed by the US Congress in 1988, and then in 2019 they proposed a new set of quality requirements for proficiency testing. These were updated in 2022. They became official law in 2024, and they get implemented by proficiency testing organizations on January 1st, 2025. Now, what do they do? Under proficiency testing, after the laboratories have received their PT materials and they have analyzed those materials and sent back their results to the PT program provider, for them to say you have acceptable performance for the results which you sent to them, they consider 2 things. One is your target value, and the other is the acceptance limit. Now, the target value is either got by reference testing, it's a reference value or consensus value. Now, the reference value is got by reference methods, which a lot of times is not very easy to get using a reference method. So most times it is got using consensus value. What does that mean? All the laboratories which participated in that cycle and sent back their results, the program provider will gather results together. After removing of the outliers, they now take the mean of all the results that were sent back and get the target value. Okay, so that is the first one. Then the next is now the acceptance limit. So that is where CLIA now comes in this acceptance limit. So the CLIA regulations specify the acceptance limit around the target value, which must be used by all approved PT programs. And this is specified in subpart 1 of the CLIA for each analyte. So if you go to CLIA regulations for each of your analytes, for instance, in chemistry, let's say maybe total protein, albumin, all that. total protein, you have acceptance limit. For albumin, you have acceptance limit. For ALT, you have acceptance limit, okay? And these acceptance limits are not uniform. So it's not like you're going to have one for each one, it has a particular acceptance limit. For some of them, it can be mean plus or minus 20%. Some are stated in percentages, some are stated in standard deviation. For another one, it can be mean plus or, that is target value, mean plus or minus 25%. It can be mean plus or minus 2SD, can be mean plus or minus 3SD. So you have to go to CLIA regulations to determine what the acceptance limit for that analyte is. And then you bring it in. That is how you can now get the acceptance limit for each of the analytes that were used during the proficiency testing. Okay, so in some disciplines, especially in clinical chemistry, most is provided almost exclusively in a quantitative format, okay, of course. But in some others, like microbiology and paths, you have some elements of qualitative and some quantitative nature because of the nature of the test they carry out, okay? So if there is maybe a slide and you're looking for a particular cell in that slide, it's not quantitative. It's either the cell is there or it's not there. So it's qualitative. Sometimes it's semi-quantitative. So that is how they get the target value and the acceptance limits for proficiency testing under CLIA regulations. So I pulled this up from the internet. This is a CAP document, College of American Pathologists document on proficiency testing failures. Yeah, I know this may not be so clear, so I teased it out for us. So let me go to the next slide so that we can see what is actually there. So my next slide are just some teasing out of what that CAP document is talking about, the proficiency testing process. So CLIA regulations require 5 specimens in 3 PT events per year. I think this is what CAP uses. So remember I said the cycles can be 3 to 6. So I think what CAP does, they use 3 cycles. So in a year, they send you PT samples 3 times in a year. And for each of those cycles, for each particular analyte, you're required to analyze 5 specimens. So let's say, for instance, albumin. So it means that in a year, 3 cycles, 5 specimens for each cycle. At the end of the year, you're going to be having 15 results of albumin for this proficiency testing program. However, mycobacteriology requires 2 events per year. Now, what does it mean when a laboratory has unsatisfactory PT performance? Unsatisfactory PT performance. So it means that the lab has failed to attain at least 80% correct results for one analyte or subspecialty or specialty. 80% correct results. Now, this 80% means 4 out of the 5 specimens which you analyzed in a cycle. However, for ABO, resource and compatibility testing, they require 100%. So you must get it right in all the 5 specimens you were sent. That is unsatisfactory. Then, what does it mean when it is said that a lab has unsuccessful performance? So if the lab now fails to attain at least 80% correct results for 2 out of 3 testing events. So within that year, you participated in 3 cycles, but out of the 3 cycles, for the 2, you got an unsatisfactory performance for 2 out of the 3 testing events. Again, ABO, resource and compatibility testing, require 100%. So that is unsatisfactory and unsuccessful performance. So what happens when a lab has an unsuccessful performance? So if the lab has not had previous unsuccessful performances, so like first timers, the first time your lab is having failed 2 out of 3, client regulations may permit technical assistance. They may send you technical assistance or training to assist you in your laboratory performances, okay? However, if your laboratory now has a subsequent unsuccessful PT performance, so after the technical assistance, after the training, and you continue testing, and then you now have another unsuccessful PT performance within 6 or fewer PT events, it is called a repeat unsuccessful PT performance. And what now happens at this period is that the laboratory is required to cease testing for that analyte for 6 months. So it is that serious. Your lab will cease testing for that particular analyte for 6 months. And repeat unsuccessful performance can be 3 consecutive failures. So if in a year, all the cycles that you participated in, the laboratory failed all 3 of them, or out of 4, so 3 times in a year, then the next one for the next year, out of 4, the lab failed 3. It is a repeat unsuccessful performance, or 2 sets of 2 out of 3 failures within 6 events. 2 sets within 6 events. So let's look at the first one, 3 out of 4 failures. You can see in 2015, for the first cycle, the lab got 20%. The second cycle, it got 60%. The third cycle, it got 100%. Then this 2016, the first cycle in 2016, it got 20%. Remember that the minimum is 80%. So it failed to get a successful performance here. It has 3 out of 4 failures here. Then in example 2, 2 sets of 2 out of 3. 2 sets. So in 2015, the first cycle, it got 20%. Second cycle, it got 60%. Third cycle, 100%. So in this set, it failed 2 out of 3. Then in 2016, first cycle, it got 100%. Second cycle, 20%. Third cycle, 0. It got 0%. So this is 2 sets of 2 out of 3. Failed 2 out of 3, 2 sets. So when this happens, the lab will be required to stop testing for that analyte for 6 months. And then what now happens? When they stop testing, there are requirements for them to be reinstated. That is for you to resume testing for that analyte. There are requirements, and it is called reinstatement requirements. And what are these reinstatement requirements? First, the lab must complete a root cause analysis. I think the next week is going to deal with this root cause analysis. So the lab must complete a root cause analysis detailing the cause. Why did they have this repeat unsuccessful PT performance? Then they must detail the corrective actions that have been put in place to prevent recurrence. Detail the corrective actions that have been put in place to prevent recurrence. The lab must provide an analysis of the impact of the PT failure on patient testing. Then they provide documentation of any required personnel training or retraining. And within that period of 6 months, they have stopped accepting patient sample. But on their own now, they are going to complete 2 events of proficiency testing for that analyte which they have ceased testing. So on their own, they are going to now go through 2 cycles of proficiency testing and be successful in those 2 cycles before they can be allowed, together with other things that they are going to provide. And they must ensure that the lab is in compliance with the cease testing directive. This is usually done by the lab management who will sign a document to state that they are no longer accepting patient samples during the cease testing. So you can see that the requirements, proficiency testing is a serious business for US laboratories, and it should also be serious business for every laboratory running human samples. Okay, so these are the reinstatement requirements which the laboratory must fulfill before they can be allowed to continue testing for that particular analyte. So what happens? All those root cause analysis, what does the lab actually do? They have to review all aspects of the laboratory. Pre-analytical, analytical, post-analytical, all aspects have to be reviewed. So pre-examination, was there compromised sample integrity during preparation, shipping, or after receipt in the lab by improper storage or handling? Now, before I need to say that before you conclude that maybe the PT material that was sent to you or had compromised sample integrity, you need to be careful before you do that. Because, for instance, in chemistry, what is sent is usually lyophilized material. And lyophilized material usually is stable for about 3 months at room temperature. And that covers for the shipping period. Okay? So it covers for the shipping period before it gets to you. And before you can say that the material was compromised, had compromised integrity, you should, a lot of times, you wouldn't be the only person reporting it. Other laboratories will also report it. But when every other person is meeting the acceptable criteria and only your lab is off, you can't, it doesn't, you may not be able to claim that the material that was sent to you had compromised sample integrity. So you need to look into your own systems. How was it now stored when it got to you? Was there proper storage, handling, labeling, processing? So you need to examine your own system. Examination, possible sources of analytical problems, your reagents, your instruments, calibrations, your calculations. You need to determine whether the error was random or systemic. The EQA materials may exhibit a matrix effect in the examination system used by the participating laboratory. Then the competence of the staff who ran the tests will need to be considered and evaluated. So you need to check all your systems, and even your post-examination, the formats for reporting may be confusing for the staff who reported. So you need to check, was it from the reporting? Was it from interpretation? Was it transcription errors? All these could be sources of error. So you need to check all your systems to be able to see what exactly is happening, how you came about performing poorly on your EQA. Okay. So this is a sample of PT results sample, of a PT results sample. This is just for us to see what it looks like. There are various formats. For reporting. So this is just one of it. Okay, so now we go to the last part of our presentation, which is the digital audit tools. Digital audit tools, because it's now solicited, it's now recommended for you to make things easy. Paper-based tools may be laborious, and then also for recording purposes, such that you have the documents whenever you want it. It's already there, and you can also input your corrective and preventive actions and be able to monitor your performance. So digital audit tools are recommended. So one example is the Slipter E tool. I believe you're familiar with the stepwise laboratory quality improvement process towards accreditation, the Slipter checklist. So this was established by the WHO's Regional Office for Africa, WHO Afro, to assess lab compliance to ISO 15189. So the Slipter E tool is very useful in as a digital audit tool, and is very much available online. Then the next is the WHO lab assessment tool. So this describes the general process for assessing labs and provides the questionnaires for national lab systems and also for individual lab assessments. And it's based on internationally recognized standards. So these e-tools, they have PDF format, but they also have Excel files. So because they have Excel files, you can input your results into this Excel files, and it can help you calculate your indicators automatically, automatic calculations of your indicators. So that's the WHO lab assessment tool, which is also available online. So this is the Slipter checklist. This is the overall score, this overall score sheet. So you can see that it covers all the sections of the QMS. It has the documents and records. It has a total point of 25, management reviews 17, organization and personnel 20. So like that for all of them, to facilities and safety 43. So for under each section, you now begin to have the questions, the checklists, which the auditor uses to check, is this available, is this available, and begin to tick and assign points to each one of them. So the total score is 258. So from this now, you can see that audits is quite a laborious process, and that is why it may not be feasible for you to do everything in one day. So you might have to section it, choose the sections you want to audit so that you can be able to do a good job. And so you can see under there, you have the stars. So if a laboratory scores 0 to 142 points, they have no star. If they score 143 to 165 points, they have 1 star. 166, 191 points, 2 stars, all the way to 5 stars. Okay, all the way to 5 stars, 244 to 258 points. So this is a very important and useful tool for any laboratory seeking audits. Then you have the Spirit E tool. The Spirit E tool is a stepwise process for improving the quality of HIV rapid and recency testing. So this is for our colleagues who work in the HIV testing centers. This tool was developed by US Center for Disease Control and Prevention, establishing minimum standards against which HIV testing sites measure their performance. So for our colleagues working in HIV testing centers, this tool is very useful for you. There are also other audit management softwares, like you have QPOS, Coltrax. These are softwares that were developed to assist in auditing process to make it easier to use. to make it digitalized so that you don't have to be carrying paper and, So it enables planning, scheduling, and tracking audits. So you have it in your system. Once you finish, you can come in, input your results, your scores, so that it stays up to date. And then it also tracks how any corrective action, you can input it there. And so this is not now about you having paper based where you have to write it down, document and everything. So even when auditors come, they just look at the digital tools and everything is there. Okay. You also have the master control auditor. These are very familiar tools in the audit processing. So these are cloud-based audit platforms which support remote and real-time audit processes. Okay. So what are the future trends in digital auditing for lab compliance? Artificial intelligence and machine learning are here with us. We cannot run away from them. We just have to acknowledge them and learn how to incorporate them into our systems. So AI-powered tools can analyze audit data, detect patterns, and predict compliance risks. So we are expecting and we know that artificial intelligence will definitely have a role to play in auditing for laboratory compliance. There's also blockchain for data integrity. So this blockchain is like networking of computer systems. So what it does is that it helps to enhance data integrity in the sense that what the system you're using, the platform you're using is not just present in your own system. It's present in a number of systems connected, may not all just be in your own place. And the idea is that once you input data into that system, it replicates all over the blockchain such that you can't change that data. So it helps to prevent data tampering. So you can't go after inputting something, you now think about something and say, maybe I should change this. No. So that is what this blockchain for data integrity is about, that once you input something, you can't tamper with that data again, okay? Then in future, we expect that digital auditing will be integrated with our LIS, integration with LIS, so that we are going to begin to have seamless data exchange between the audit tools and the laboratory information management system for comprehensive compliance tracking, okay? Then automated compliance monitoring, real-time alerts, and predictive analytics to address potential non-conformities before audits. So these are what we are expecting that the future holds for auditing for laboratory compliance. Okay, so in conclusion, we have talked about audits and we have agreed that audit is an essential laboratory process which is aimed at continuous quality improvement. So for your continuous improvement process, you cannot do without auditing your processes. And when it is used together with EQA, it attests to the effectiveness of the implemented QMS, and moreover gives confidence to both the laboratory clients and even the laboratory staff as regards the quality of their services. So this is where I end my presentation. Thank you very much. Dr. Bruno, this is the process for last week. Next week, sorry. Okay.
All right. So, thank you very, very much. Okay, carry on, please. You may continue, please.
Okay, so I'm told next week we'll be looking at process improvement and risk management in lab QMS And under that, we'll be learning implementing Lean and Six Sigma for process optimization. We'll be talking about root cause analysis and CAPA, corrective and preventive actions. We'll also be looking at proactive risk management strategies for laboratory quality enhancement. Thank you very much.
All right. Thank you very much, Dr. Meka, for the resounding presentation. We would give some time to attend to any questions or comments arising from this presentation. We would like everybody who would want to talk about or ask any question to be very snappy and straight to the point. Thank you very much. So we'll wait for questions to come in.
Good evening, ma.
Good evening. You're welcome.
Okay, thank you. Please, my question is with respect to the WHO Afro Slipper checklist, where you have from 0 to 5 stars. Please, is there any international or like worldwide acceptance range? Like from how many star is acceptable? Or must it be met 5 star?
No. You know this is auditing. You know this is auditing, and auditing is looking at your continuous improvement of your internal processes. So it's like you checking yourself. So the idea is, if you use this checklist and the first time you got 1 star, you should aspire to get maybe 2 or 3 stars and not going back. So it's not expected that if you use it first time and you got 3 stars, then the next time you use it, you go down to 1 star. No. So the expectation is that you move up, and then when you get to 5 star, you remain there. You remain at 5 star. Not that you get 5 star this year, then in the next 2 years, you've moved down to 3 stars. No. Okay, so this is looking at checking your internal processes. Okay, I don't know if you're okay.
Thank you, ma. Yes, I got the answer. Thank you, ma.
Sorry, can I put in a word? Can I say something?
Please go ahead.
Please go ahead.
Okay, Professor Kujobi. When you get 5 stars, you could actually apply for an external accrediting body like SANAS, that's South Africa, and very soon we'll have NINAS. So that's the idea. By the time you reach 5 stars, it's not easy to get 5 stars. So by the time you get to 5 stars, you can actually apply for an external body to come and accredit you and license you.
Okay, thank you, ma, for that very useful comment. Thank you so much.
You're welcome.
Thank you, ma, for your presentation. Please, on the same question, does it mean that this SLIPTA checklist is only for internal quality assessment? Is it also for external quality assessment?
Okay, like I said, for external audits, remember I said that external audits is by external auditors, and they are mandated, kind of authorized by a particular agency, and that agency is looking for a particular thing. Okay, it can be a funding agency. It can be, let's say, an agency supporting tuberculosis testing. So they want to see if they will include your facility into facilities that test for tuberculosis. So they have something in mind when they are coming. But WHO Afro Slipper checklist is checking the overall system, your overall system. So this may not be adaptable to what the external agency has in mind when it's coming to do an external audit on your facility. I don't know if you get what I'm saying.
Yes, I understand you, ma'am.
Okay, right.
I have another question.
Okay.
Please, and in terms of the proficiency testing, you said there are some risks to the patient. what risks to the patient in terms of that proficiency testing? I've forgotten how to phrase my question, but you said there's some risks that may be posed to the patient.
No, it wasn't in proficiency test. It was in audits.
Yes,
It was in
internal
audit. Yes, that the requirements. I said that the ISO 1518 requirement, part of requirements, mandates the laboratory that their audit program should include processes that take care of laboratory's activities which give risk to the patients. Okay. Now, what that means is you look at your laboratory processes. Where are patients likely to be more at risk from? From my own perspective, places like phlebotomy, you can consider that a place where patients can be at risk. Apart from that, any laboratory taking human samples, like we normally say in the laboratory, no test is better than wrong tests. So all your activities that directly impact on patients' results, all activities that directly impact on patients' results, I consider all of them as putting the activities that can put the patient at risk. I hope you understand what I'm saying.
Yes, ma'am.
All activities that directly impact on your results, I consider all of them as activities that will put the patient at risk. Because when you generate a result, please can you mute, please? When you generate a result that is wrong, it's better you did not give out a result at all than giving out a wrong result. Okay? So that's the way I look at it. And that is why auditing looks at the entire process, all the processes in the laboratories. Okay? Are you okay?
Thank you, ma'am. Yes, another question, please. If the external auditors find a problem, can they prefer a solution?
Definitely. Remember we said auditing is not for punishment purposes. It's not for punishment purposes. So they are coming, an external auditor has something in mind. Maybe they want to mount a program in your facility. So they want to know what you have. And if they now come, if what you have is not satisfactory for them, they go back and they weigh their options. Is it up to a standard where they can easily beef up to meet their standard, or is it not? So when they come, they might have a minimum standard in mind that if your facility meets this minimum standard, okay, they can now beef it up to a particular standard which they want. But if you are below that minimum standard, they may have to take that activity to another laboratory. So it's not punitive, it's not for punishment. Okay? Sometimes they profile a solution depending on the objective of the audits, on what they have in mind. All right?
Thank you very much, ma'am.
Okay.
Hello, good evening.
Good evening.
Yeah, this is,
I can see some people raising their hands in the start group. If you don't mind, can we CP Uche?
Okay. Yeah. Good evening, ma'am.
Good evening.
Thank you very much for such a wonderful presentation. So I have series of questions starting with the auditing, the first part of the presentation. So you mentioned impromptu audit, and I was wondering if audit is a fact-finding process and not a fault-finding. And according to the guidelines for auditing management system, that's ISO 190011. Okay, the first stage in conducting an audit has to do with initiating an audit, whereby the auditor will establish contact with the auditee. So if that is part of the guideline, so where is the place of impromptu audits? Because when you were presenting, you said if you want to catch people the way they are, and I also believe that if you want to get people that do window dressing, in auditing, you check their processes, documentation and records. Okay, it's at the record process, that the record part, that you can catch people that window dress. So I don't know, and I didn't get the impromptu audits, if at all it's a part of an audit process, considering the guideline specify you contact your auditee. So that is the number one question. And then the number two question is, on EQA, of course, we all know that we're in Nigeria, and then EQA enrollment is so expensive. Not all labs can afford this enrollment. Okay, so are there alternatives to this EQA, enrolling or registering with an EQA provider? Are there alternatives that are specified in the standards? Where one, and if there is any, could you just comment on that? And then the next question is, can commutability of an EQA sample, because most times you talked about consensus, and even when a reference material is used as a target, sometimes the PT providers, the sample that will be sent, can commutability be an issue whereby someone is assessing it in his facility, he's getting something which according to his processes, everything in order, or he's getting a different result from someone who did something according to standard too. That's why I say, can commutability be an issue, or is there any way the PT providers ensures commutability of the PPS samples? And the last one is on Afro Slipper checklist. It's not really a question. I just want to comment on that. Okay, it's not imperative that a lab goes through Afro Slipper, the star rating, before getting accreditation. Okay, of course, we know that this checklist was adopted in 2009. Okay, when WHO. The reason for that is because, of course, WHO and some other foreign bodies saw that labs and other facilities in Africa are not, up to standard. The checklist was created to help lab. When you have something that is guiding your improvement, it helps you. Okay, so it was created to help lab, but that doesn't mean every lab must. The essence of this Slipper checklist rating is for you to get accreditation. Is like the end goal of all this whole thing, to get accredited, of course, serve the patient. So I'm just trying to say that it's not imperative that a lab goes through Slipper, getting 5-star, 2-star, and the rest of it. If your processes are strong enough, you can go straight to accreditation, where you apply to the certification body and they will come for accreditation. Thank you, ma.
Thank you very much. So yes, I quite agree with you. Nobody said it's mandatory for any lab to go through the Slipper processes. No, nobody said that. So like you rightly pointed out, if your processes are strong enough, yes, and you are sure that you're on the right track, you can, of course, invite accreditors to come and accredit you. But it's an audit tool which helps you to know where you stand, okay? Because it's always better for you to assess yourself before calling an external body to come and assess you. So it's always better for you to say, okay, I'm at this point. Am I ready to invite external bodies to come in? So that's just but there's no hard and fast rule about that, okay? So thank you. Then the impromptu thing, yes, you're correct. It's not, yes, it's required. And while I was talking, I mentioned that that external audits are quite cost intensive. So oftentimes you need to inform the lab before you come so that they put things in place. And even the relevant personnel who you need for that audit, for that your audit process, they should also be available. Okay, we are just saying that for some reasons, if you really want to know what is going down in a lab, yes, you can liken it to our everyday activities. If you really want to see real time what is happening, come unannounced. But like I equally mentioned, it may not be feasible because
Yes,
you
ma'am.
don't want a situation where you come in and then even the key personnel who you need for that auditing are not available. Okay, you may just be able to go around on your own, but you may not achieve much. So I said it then that we just have to strike a balance in between, because you and I know that a lot of times when auditors are coming, we begin to put a lot of things in place. Begin to,
Yes,
it's we now. We begin to put a lot of things in place, and those things may not be sustainable. After the auditors have come and gone, we relax and go back to how we were before. Okay.
Yes, ma'am.
Then the alternatives. These are the alternatives. I just put up the slides again. The section 7373 said that when the EQA program is either not available or not considered suitable, there are acceptable alternatives. Okay, and they gave 1, 2, 3, 4, 5, 6, 7 alternatives for laboratories. So yes, we know that EQA programs can be expensive and not every lab has, but it is the most acceptable. It is the most objective. So I don't know, maybe just the stakeholders might need to come together, put heads together to ensure that this happens. Because I know already, even in Nigeria, as we are now, many laboratories are keyed into EQA programs. Okay, so it's just for us to continue working towards collaborating with the providers in ensuring that we get it right, because that's the whole essence of this whole thing, for us to get it right. Okay, then commutability. Yes, the PT providers, they try as much as possible to make these materials commutable, because that is the basis for their sending the materials in the first place. It is one of the criteria for that the PT program. It has to be commutable with patient samples. Otherwise, your results will not be reflective of what you should be getting with patient samples. So it's a criteria. It's one of the requirements for the material, for the PT materials. Okay.
Okay,
I don't
ma.
know if I've been able to answer your questions.
Yes, ma. Thank you, ma.
Thank you too.
All right. We had Kelechi Kalu who had his hand up also, but it seemed we have lost him due to his network connection. Maybe when he comes back, we can hear from him. For now, I think there's someone who attempted to ask a
Sorry, I'm
question.
back.
On Emmanuel.
Hello? Hello?
Kelechi, are you back?
Yes, sorry, my network was unstable,
Yes,
but it's okay now.
We noticed that. Please proceed with your question.
All right. Thank you so much, Ma, for that beautifully rendered presentation. So mine is more on the proficiency testing. Yes, we understand that it is a critical component of laboratory quality assurance program that is used to evaluate laboratory performance and ensure accuracy and reliability of test results. So the aspect I need clarifications on is the aspect where the result is compared with other laboratories, the inter-laboratory comparison of results. That's to achieve a target result. What I want to find out is the laboratories in question, are they the ones that will be selected by or there are specified laboratories, or maybe laboratories that are close to the individuals, or the individual, yes, laboratories that are close to the individual participants. are they going to use their area of coverage laboratories to achieve a target result, or it has to be results that are, not within their area of coverage, or probably far away from where they are? Because the reason I'm asking is because of issues around temperature, generally all those things that could affect the ability of, let's talking about the pre-analytical issues that might arise during laboratory processing. So I would like to know, when it comes to achieving a target result, are they going to be using laboratories that, or areas that are far apart, to be able to do that?
Okay, thank you for the question. Now, how PT programs, there are some PT, okay, let me even, there are some PT programs, or PT programs can be, for instance, a PT program provider can be in America and be supporting a laboratory in Nigeria. Are you with me? So it's not about proximity to them, no. If you were here when I discussed this, I talked about the shipping period. So a PT program provider can be anywhere in the world and support a lab anywhere in the world. All they need to do is to ship the PT materials to that laboratory. I mean, anybody can travel from Nigeria to anywhere. You are not going to spend one week in transit. Okay, so that is also how they ship these things to us. So it's not about proximity. It's about the labs that are keyed into their PT programs. And how the target values are generated is that all the laboratories that are keyed into that PT program, they analyze the materials that were sent to them and send back their results. Of course, send back your results by email. The world is a nuclear place now, so just send back your results from anywhere you are in the world, and then they gather all of them together, all the results for a particular analyte, remove the outliers, and then get the mean of all the participating laboratories for that particular analyte. And that is how they achieve the target value, by consensus. So this is consensus value now. Okay. I don't know if I've answered your question, or are you still confused?
Yes, Ma, you have. So what you are saying in essence is that the laboratories from which the target mean is getting from are those laboratories that participated. And
Exactly.
from what you are saying, there are laboratories that are, let's say, in Africa, or a particular region of Africa, and not laboratories that are not in Africa, for example. Is that what you're saying, Ma?
They are not grouped based on locality. They are not grouped based on locality. In fact, the way they group them is by your method.
Okay.
Yeah, it is by people who are using this, is by method. All laboratories who are using this particular method, that is how they group them. It's not by locality.
Okay. All right, I'm okay, Ma. Thank you, Ma.
All right.
All right. Looking at the chat room, let's hear from Professor Comfort Akujobi.
Thank you. I just have thank you, Dr. Meka, for your exciting presentation. I want to make comment, and it's for that person that asked 4 questions. I can't remember the name. The processes, he said that SLIPTA checklist, I agree, in as much as we all agree that SLIPTA checklist is not a prerequisite for calling for external assessment accreditation. He said that when the processes are strong enough, Please, how do you know when your processes are strong enough? What document, what criteria do you use? That's why they all agreed to use this Afro checklist as a yardstick. So by the time you check your processes and procedures, they tally with what is there, you will be assured that when you call external bodies that you will meet up. So just saying when your processes are strong enough, it's not scientific, evidence-based, except you also you write your own protocol. You adopt your own protocol, which should be standard, and will also meet up with the sleeper check. Because when external bodies come, what they are looking for or how they are going to audit you will be based mostly on what is already on the Afro WHO sleeper checklist. That is one. Then the second one, impromptu auditing. It is doable and it is being done. For example, there are some centers, of which UNTH is one of them. They are being funded by this MSH, Fleming Fund. And Fleming Fund is using MSH, Monitoring Science for Health, or so. So, Management Sciences for Health, sorry. They audited some labs. They are mostly on antimicrobial resistance. That's where their interest is. So there was an audit, a baseline audit last year, August, September, October. Some hospitals were chosen. So after that baseline auditing, they sent mentors to mentor this lab, the staff. So from time to time, they will go and do impromptu audit in those labs. The mentor will not know, the mentee will not know. So they just come there, assess what the mentor has been doing. Because if they inform the mentor, they'll now come and do this, our normal eye service thing, cook up, frame all these things. So they just come. They are coming to assess, to audit what the mentor has been doing and what the mentees have been doing, whether what the mentor said he has done is what exactly he has done. For example, I am mentoring microbiology in UNTH. I heard they have come. They came early this month, March. I didn't know. The HOD did not know. All of a sudden, from the grapevine, somebody called me, that MSH people. They said, that's fine. That's the idea. I like, come and see what we are doing, not be prepared. Be prepared means you do eye service and wait for them to come. But they just come suddenly and audit you, or will I say audit both the lab and the mentor. So impromptu auditing is actually feasible and is being done. And I think which of the geopolitical zones is benefiting from that? LUT is there, UNTH is there. I think Zaria, there are about 11 centers. So from time to time, MSH will send their people impromptu. They will come and do the audit to know whether Fleming Fund is actually spending their money wisely or people are just doing eye service. I think that's what I have to say. Is it clear now?
Yes, thank you very much, Ma, for that very valuable contribution. Thank you so much.
Thank you very much, Prof, for that. There, in the same vein, there is a comment in the chat room that from Bonaventure Basil. He says the goal of quality is to build a culture, a norm of doing things the right way. I think we must work towards this and allow room for impromptu auditing. Auditors visiting, we always meet the same processes at all times. I think this actually reinforces further what the presenter for today, as well as other contributors like Professor Kujobi have just said. All right, so do we have more questions? I can't see any hands raised in the chat room. Somebody attempted to ask a question. Was that Onu Emmanuel?
Yes, good evening, sir. I'm still here.
Okay.
Let me know if you can hear me. Thank you.
Please go ahead, we can hear you.
Okay, thank you, Dr. Meka, for the presentation. It was so insightful. I must confess that the lectures have been getting better and better by the day. Thank you also, Dr. Bruno, for organizing this. From the presentation, I noticed that one important aspect is documentation. And my challenge is that it is possible for a lab to be doing a lot of things right, but yet fail in documenting them. And from what you presented, Ma, you emphasized that without documentation, it will not be possible to make evident that a lab is actually doing the right things. And when you look at the way we work, or the way work is done in many labs, people are just very much interested in carrying out their duties. Maybe somebody at the bench will just be mindful of just doing whatever he wants to do at the bench and zoom off. Now, my question is, how do we get this documentation to be done properly? Is it possible that somebody will be mandated to be doing the documentation? Or how is it done such that there will be proper and detailed documentation, even when the right things are done? Thank you.
Okay, thank you, Dr. Onu. Yeah, that is a very important question, and one which has been a challenge to many of us here in developing countries. Documentation is an issue for us. Okay, there was a time in my own center, we were still having the same discussion. So the issue was, when there is an equipment maintenance, the engineer is supposed to document that I carried out this maintenance. But you find out that because a lot of times the engineer will work beyond working hours. So when the staff will want to go home, okay? So the processes will not be as smooth as it should be. The engineer may eventually finish working and there will be no person to give him the document to document what he has done. And at the end of the day, the engineer goes, the person on the bench goes without any documentation. So it's a challenge. And the person responsible is the person who is doing the work. If an engineer is working on the equipment you're working on, it is your responsibility to get the engineer to document that process. Okay? It's your responsibility. If you're the quality control officer in the lab, it is your responsibility to document the QCs. Yes, the person on the bench will document his own, but you as a QC officer should also document your own. So anything that is not documented, like I said, is not done because the auditor was not there when you were doing it. He only relies on the documents you give him, you show him. It happens all the time, and it is just for us to imbibe that culture of documentation. Yes, it may be a bit inconveniencing in the beginning. When you're beginning it, you may find it to be more work to being added to your normal work, but it is worth it. It is worth it because that is the only evidence that you have done this thing. And it starts with a lab policy. You know that if you walk into a number of laboratories, just walk into their reception and ask, or even if I ask us here now, if you're working at a reception and a client brings a hemolyzed sample, what do? I know the greater percentage of us will say we reject the sample. Fine. Why do you reject the sample? Somebody might say, okay, it's part of our rejection criteria. And then if we now say, please, can I see where it is written? That is where the trouble starts. Okay? Because yes, you may know it that hemolyte sample should be part of rejection criteria. But is it written anywhere? It should be written in your lab policy. So this is all part of it. It starts with your laboratory having a policy written, not just this is where we do things. It has to be written. So if we even start with this SLIPTA checklist, you can see that once you come to the first documents and records, you may even score 0 from there and you get discouraged, okay? Because it relies a lot on documentation. So there's no other way to do it than to start doing it and then build up that culture. Let it be part of you. Let it be part of you. And another big one is corrective actions, preventive actions. We do all these things, but they are not written down. Occurrences occur in the laboratories. Somebody gets pricked, somebody is hurt, somebody, these things happen where they are not documented. They are not written anywhere. They are all challenges. And that is all the reason why we have to know of all these things. Knowledge is first, awareness, and then we begin to practice these things. That is the whole essence of it. Thank you.
Sorry, man. Part of the challenge is that nobody takes responsibility for many of these documentations. Just for instance, what you just mentioned, an occurrence. Nobody takes responsibility for documentation. Can there be a way of dedicating somebody to say, okay, you are in charge of whenever things happen, or make sure that documentations are done anywhere that they're supposed to be done? Is it possible?
Of course, it's possible. That should form part of your lab policy. That's why we keep on talking about lab policy. You designate people to be responsible for something. If you in that way, the person knows I am responsible for this. So if that thing is, you're looking for that person for this thing, you know who to ask. If nobody is responsible for anything, then that thing doesn't get done. You must designate individuals. So when you are creating portfolios, because I know that in many of our laboratories, we have safety officer, we have QC officer, we have this officer. So when you create those portfolios, you give them responsibilities. It's not just enough to give titles. You give titles with responsibilities. And then you train your staff, train and retrain. It's a continuous process. That's how to get it right. Okay, thank you.
Thank you, ma'am.
Okay.
All right, thank you very much. There's somebody else that wants to say something from the chat. Is it CP Uche? Can you be very brief?
Okay, thank you, sir, for giving me this opportunity once more. Okay, thank you for your presentation as well, and thanks, Prof, for your explanation. Okay, what I was just trying to say was, okay, if we are talking about audit, okay, there is a standard ISO 19011. That standard talks about auditing. Okay, I know sometimes we bump into a facility in a bid to do something check, and we'll call it audit. Okay, this standard that stipulates the guideline for an audit, I believe if there's a guideline and someone is going against that guideline, we might look for another name for that thing that is being done, not calling it, because once you call something an audit and there's an international guideline that states the principle and the processes of an auditing a management system, I think anything outside that guideline can be given a name that is not an audit. I can bump into my people or maybe a group of people doing something just to check them. I can call it on-site inspection or something. But I believe if it's called audit, it should follow the guideline, and the guideline doesn't specify or give room for an impromptu check or something. You must go through these processes, initiating it, establishing, and like the speaker already said, determining the feasibility of that. Any other person can do something else, but maybe it might not go with the name audit. It can be called inspection or something, but once it's an audit, there is an international guideline for auditing, and it must be followed through. Thank you. That's my own contribution. Thank you for your explanation.
All right. Thank you very much. You've all made very useful contributions to this topic. I would have loved us to extend this conversation further, but we still have more webinars to participate in. So we'll have to call it a day. Thank you very much for joining us today for this informative session on ensuring, all right. Thank you very much for joining us on today's session of. We hope you found these insights that have been shared today and the strategies to be very valuable in enhancing your laboratory quality processes. We would like to extend our sincere appreciation to the College of American Pathologists Foundation for their generous support in making this webinar possible. We also thank our facilitator, Dr. Meka Ijeoma, for sharing her expertise and guiding us through today's discussions. If you have any further questions or would like to continue this discussion, please do not hesitate to reach out to us via the email on the last page on this screen. Before we close, we would like to remind you that for attendance tracking purposes, please ensure that you are signed in with your real name. This will enable us to verify your participation and provide certificates of attendance as needed. We also invite you to join us next week for another engaging session in our laboratory quality management webinar series. Until then, let's continue striving for excellence in laboratory quality management together. Thank you very much and have a wonderful day. Bye to everybody.
Bye.
Bye.
All right.